Hello students, the purpose of this video is to address the elephant in the room in a preparation, and as all of you know, it is currently revision. And guys, revision is the most important part of preparation of any kind of competitive exams. The reason being, any competitive exam, and moreover, if I talk about medical subject, it is one of the most difficult one because we have 19 subjects, and in those 19 subjects, while preparing, right, you are going through 19 subjects, and suppose if this is the volume of information that you have gone through that information in 6 to 7 months, right? But you need to remember this huge amount of information on that one day, right? So the purpose of revision is to keep on squeezing this information day after day, so that in revision on that very one day you remember maximum amount of information, so that you can get maximum positives in the exam, right, in your MCQs, whatever it is. So that is all about revision, guys. It is a trick. Revision is a trick, yes, as to how we can squeeze that information. And for that, today we'll be discussing about how to plan your revision, and I'll give you my inputs. I'd posted in Facebook as well to ask your doubts, and you have commented. Many of you have asked your own doubts about revision, and certain points of them I have incorporated into this video. Plus, I'll be going through all of your doubts one by one as well, right? Let's begin. So let's make a plan. The first question, guys, and that is the most pertinent question about revision, is how many days, right? So how many days should one give for revision, guys? This is something which many of you have asked as well, and this is obviously I would have discussed it. How many days? Now, the ideal number of days, guys, according to me, now this is subjective and it might vary from person to person. But what is my thinking and what I would have done, whatever I'm telling you now, is I would have done in your place, right? So I'm telling you the same thing. So how many days for revision, guys? 90 days is an adequate number of, it is a good number of days for revision. Many of you might be having more number of days. That's well and good. More number of days for revision is always most welcome. But yeah, I want to mention about those students who might not be having these 90 days for revision, might be because of they started late or there are some issues. But I want to tell you, if you have 60, 70 or 80 number of days for revision, do not think you are off the competition. You are still in the competition. This is just, I'm standardizing, right? Everything what I will telling in this is a standard process, right? But it is not a rule. You can create your own rules. You might revise in 60 days, and even then you can get a good rank. But if you have 90 days, then you can cruise through revision quite comfortably. Now guys, the first question we have addressed is how many days that is required for revision, that is 90 days. Second question is second question, I have noted down all your questions. Second question is how many revisions, guys? So these are 90 days, and how many revisions am I supposed to do in these 90 days? The answer is 3. So 3 revisions minimum. A minimum of 3 revisions is important. The reason being, guys, if you want to do 3 revisions, if I go with 1 or 2 revisions, just let us say, then what happens is you'll always be confused in between 2 options. As it is, that happens. But then the number of MCQs where you'll be confused in between 2 and 3 options, there would be a huge number that will drastically pull down your rank in the exam, right? So the revision is a thing that does what takes things into your permanent memory, and that is what we are trying to do here, maximizing our output by revising at least 3 times. It's a different question. How am I gonna utilize my 90 days into 3 different kinds of revision? As here, see, the preferred method of revision is an inverted pyramid shape like this. The reason being, guys, whatever information I have, this huge number of information, I need to gradually squeeze it down to that very one day in your exam, right? So here we'll divide our revision into 3 phases. One big revision followed by one mini revision followed by a small micro revision, right? So here, whatever 90 days we have, how am I gonna divide those 90 days into these 3 phases? Because I'll help you to calculate those number of days. Now here, if I calculate those number of days, what you get here is from this 90 days will take 64 days. 64 days for the first revision, big revision. So all in these 64 days, I'll be revising the 19 subjects theory, plus I will practice MCQs as well every day. Plus, guys, I'll give grand tests, one or two grand tests in a month, right? Whatever access I have. And now here, in this case, I'll do this for 64 days. Then for 21 days, I'll repeat again the same thing. Same thing here might be the grand test that I'll give here in these 21 days. I might be able to give only one grand test or two, whatever it is available to us. Plus, we'll practice MCQs as well here. Now, one difference here is that, guys, the MCQs which I'm going to practice here, preferably it is wise to go subject wise practice of MCQs in these 64 days. Now, this is a doubt that has been asked by the students. And here in these 21 days, I can go for mixed because I have already revised. I know the subjects. Now it is time to test how am I going to solve those MCQs when does not belong to one subject, but it is a mixture of different subjects, right? So these 21 days try to solve MCQs, not subject wise, rather by mixing up all the subjects. And at last, 5 days. So 64, 21, 85 days are gone. Now I'm left with these 5 days. That 5 days, guys, is something I'm gonna do here, something different. And what is it gonna help me in these 5 days? I'll try to amend all the leaks that I have in my preparations. For example, I'll take care of the volatile subjects, my weaknesses, the short subjects. So see, guys, how am I supposed to plan these 5 days? Suppose these are the 5 days, right? 1, 2, 3, 4, 5. And this is the 5th day. Tomorrow is my exam, and today what I'm gonna do is I'll revise 3 subjects: pharma, biochemistry, and micro. And I'll revise 3 hours each. 3 hours each, so I have 9 hours approximately. I can revise these 3 subjects. Now you might be thinking, why these 3 subjects day before the exam? The reason being these are most volatile subjects. You tend to forget things in these subjects, like in pharma, the drugs of choice, right? Some specific side effects, biochemistry, the enzymes, the cycles, microbiology, the appearances, right? So all these things you need to revise. What I mean to say is, in these 3 hours, what you need to do is you just need to take your notes, which you have studied for 3 to 4 times already. Now what you need to do just is take your notes, flip through the pages, and you would have already marked different points, and you know that in each and every page you have some important points everywhere, and you know those. So you just have to briefly gaze through them, just flip through the pages. So this will help you in recent memory of these 3 subjects, which are basically subjects which are very volatile, right? Number 4, guys, what I'm going to do here on the 4th day, I'll revise 3 subjects: SARP, skin, anesthesia, radio psychiatry. Now these subjects I'll revise 2 hours each. 2 hours each, so 8 hours of skin, anesthesia, radio psychiatry. I'll flip through the pages again. Why I'm focusing on these 4? Because usually students who do good in their exams, in these NEET exams, their efficacy in these subjects is almost 99 to 100%, because skin, anesthesia, radio psychiatry, almost most of the MCQs, 99 to 100% are solvable. So if you solve all of these MCQs, it will help you in the exam. Number 3, ophtha, ortho, ENT. Now these are again short subjects, very much you can revise 3 hours each, and they will constitute around 45 to 50 MCQs, guys. And ophtha I won't say, but ortho and ENT, almost 95 to 98% of MCQs are solvable, and most they solve those. Ophtha sometimes it is difficult, but nevertheless it is also an important subject, and you have a huge chunk of MCQs from ophtha. So 3 hours each will revise these, and now we are left with these 2 days. Now guys, what am I supposed to do in these 2 days? I'm supposed to cover my weakness. What is my weakness? See, among those 19 subjects we have, there are at least 1 to 2 subjects where we always find ourselves on a wet wicket, right? sticky wicket. So we don't like to study those subjects because we are weak in those, and they hurt us a lot in the exam, right? So what we gotta do in these 2 days, I will zero in on at least two subjects which are my weaknesses. For example, let us say anatomy is my weak subject, and which was obviously anatomy, and second one is, let us say, pathology. So let us say these are two of my weaknesses, right, in my ship. These two subjects can drown my ship of preparation. So what I would do here is one day each, I'll again revise anatomy and pathology. So you can see, guys, what I've done in these 5 days. What I've done in these 5 days is I worked upon the volatile subjects. I've just revised them. That will help in recent memory, as well as that will boost your confidence, right? I've revised the short subjects where toppers, they have good efficacy in these, and other short subjects like Opta, Ortho, ENT. Plus, I've covered up my weaknesses. So if I do this in just these 5 days, I'll be able to solve at least 2 to 3 MCQs more than I would have if I had not done this. So these 5 days will make a huge impact on your results. The reason being, as you know, that one MCQ here and there can make a lot of difference in your exams. So as I've told you how to plan these 5 days. Now let us go back and see now how can you plan these 64 days and 21 days, right? So the 64 and 21 days, how am I supposed to plan this? I'll give you a brief idea. So what I've done here is I've written down your 19 subjects here, starting from medicine to pediatrics, right? And we will see how we can divide these 19 subjects in those first 64 days that we had planned. Suppose I have these 64 days. So how am I going to divide this? Because here I can give 7 days each to medicine and surgery. They would consume obviously maximum chunk of days. 4 days each for obs, gynae, pharma, patho, PSM, micro, biochemistry, anat, physio, and then 2 days each for the remaining subjects. Right. So if you do that and if you make a calculation, you'll get down to 64 days. Now, guys, again, I want to remind you that this is not compulsory. I mean, you need not obviously give 7 days, all of you. It depends. It's subjective. It differs from person to person. For example, I'll tell you how. Let us say some of you that you don't want 4 days for physiology. Some says that I can do it in 3 days because it is one of my good subject. Then you have more one extra day and you want to add that to medicine. This medicine becomes 7 plus 1 day for you, right? Someone says that, right, I don't want 4 days for micro, I want only 3 days for micro, so you have more one day for surgery. So this is called as tailor-made strategy. So where I'm just giving you the basic idea. What you have to do is you have to replicate it and make one for yourself that suits you, right? For example, someone here says that, right, skin anesthesia, radio psychiatry, here I'm having 2 to 4 to 6 to 8 days, and someone say I don't need 8 days. Let us say someone says that I need only 5 days. I need only 5 days for these four subjects, and you have 3 more days extra, so you can use those 3 days wherever you want it. Like suppose you want one more day for pharma, or if you want more day for PSM, so you can just tailor make this. But at the end of the day, remember, you cannot breach this threshold. The threshold is 64 days. You cannot breach that. So in these 64 days, whatever combinations of days and hours you want to make, you can make, right? Then these 64 days, what you need to do is, apart from finding out, the first thing you need to find out is how many days you can give to each subject. This is the first thing. Second thing, you need to find out which subjects are stronger and which subjects are weaker. For example, here, let us say, for the sake of example, let me say that medicine is weaker for me. Surgery is, I'm strong at surgery. Obs, gynae, I'm strong. Let us say pharma, I'm weak. For example, patho, I'm weak. PSM, I'm strong. Micro, I'm strong. Biochemistry, I'm weak. Anatomy, I am weak. Physiology, I'm strong. Ophtha, I am weak. Ortho, strong. ENT, strong. Skin, anesthesia, radio, weak. Psyche, strong. FMT, strong. Pediatric. So I've just taken an example, guys. Not about me or you. It's just an example as to how I have to classify my subject as either strong or as weak. There is nothing in between. It's either, it's binary. Either you're strong at it or weak at it. And I'll tell you why I need to do this classification. The reason being, when I'll be discussing the next segment as to how to plan one day of a revision, how to plan on that particular day. You'll not be revising the whole subject throughout the day. It will create a huge amount of boredom and your productivity would be lesser. So what I'll be doing in one particular day is combining two subjects. One must be strong, one must be weak. So I must have an idea about that. So that is why I need these. And then again for 21 days, the revision of 21 days, guys. Here, what I'm gonna do here is I'll give the days here. Let us say for medicine, I'm given 2 days. Surgery, I've given 2 days. And let us say for all of these, I've given 1 day each. If I divide like this, 1 day each to all of these at the end of the day, and 2 days for medicine and surgery each, you would see that I will come down to 21 days. Again, you can change this. For example, let us say here, you would say that I don't want 4 days for skin anesthesia, radiopsychiatry. You can do it in 2 days. Now, well and good. If I can do it in 2 days, I have 2 extra days, and I can have 2 extra days, and I can take those 2 extra days, and I can add 1 day each to medicine surgery. So you have to look it out for yourself how you want to make these combinations in these 21 days, right? So guys, here, so this is the plain idea, and if you want to go with this, you can go with this as well. And you might argue here that you're having more time here as compared to those subjects where you had 4 days. Here, if you have more time, you can solve more MCQs, right? You have more time for MCQs here. You can do that, or you can cut down these days and add to pharma, patho, or any other subject if you want. So, but at the end of the day, you have to remember that you cannot breach this, right? 21 days. That's it. So here, now here as well, you can make combination. You can combine for a day half medicine, half pharma, something like that. Your stronger and weaker subject, you can again make a combination. Or if you want, you can go through the whole subject as well. Now it's purely subjective as well. Both can be done here, but here I would not advise you to study the whole subject. Here is up to you. I leave it up to you, whatever suits you. You can do that. And so guys, if you now look at this pyramid, I have solved this pyramid until now. How I'll begin my preparation, 64 days. I'll be studying those 19 subjects. I'll be making a plan as I have designed just now. I'll be revising MCQs, preferably here. The MCQs must be subject wise. And I'll be giving 1 to 2 grand tests per month. 64 days means I'll be getting 2 to 4 grand tests here. 21 days, guys, again, I'll be revising those 19 subjects again, but I have lesser time, right? Here, the MCQs I'll be solving should be a mixed pattern because I'm cruising near the exam now and I need to adapt more towards solving MCQs when they're jumbled up from different subjects. Plus, at the end of the day, I'll be giving a grand test in these, and this should be probably your last grand test prior to that exam, right? After this, what we're going to look at here is your next question is the third question, guys, is how to plan a day. Okay, it's again a very important question, guys. How to make a plan? How to make a plan for one particular day to get maximum output of yourself without getting boredom. Now, how many hours, guys, you can give per day? 10 hours, let us say. Now, 10 hours is maximum, which is productive with attention you can give as per me. Now, you might say you're studying 13 to 14 hours, but 2 to 3 hours is being wasted in WhatsApp, Facebook, and other things, right? So 10 hours, when I say 10 hours, it is the productive 10 hours, nothing else, right? So how am I gonna divide these 10 hours in a particular day, guys? First thing is you must combine two subjects and one of them has to be a weaker subject, one of them has to be a strong subject. So I'll make a combination of one weak subject, one strong subject, and that is how I'll combine. So I have this 10 hours for a day. And guys, I'll divide this 10 hours into 7 hours and 2 hours. Now 3.5 hours each day I'll be studying my strong subject and my weak subject. So something new in these I'll be revising. whereas 2 hours I'll be doing the MCQs for 1 hour each. So I'm dividing this into 1 hour each, you'll understand in a short while. And then 1 hour, guys, every day I'll keep for revision. This is very important. It should not happen that you're revising, but at the end of the day, when you reach towards the end of revision, you have already forgotten what I've revised in the beginning. That shouldn't happen. And for that, you have to keep revising whatever you have revised yesterday as well. So this is called as multiple revision, right? Multiple layers of revision. And this will help as a cushion as well. I'll tell you how. Now see here. So if this is my plan, how am I gonna start my day? Let us begin. I'm gonna start my day with 3.5 hours. So first 3.5 hours, what am I gonna study? I'm gonna study that subject where I am weak in. Do not begin the day with subject with which you are strong at, because towards the end of the day you'll have boredom, you'll have fatigue. But if the subject is stronger, you'll have the stamina, right, at the end of the day to study a subject which you like, which you are stronger in. 3.5 hours. Then guys, 1 hour of MCQs, right guys? 1 hour MCQs related to that particular topic I'll be revising here. And remember, you need to mix up things. Do not go simultaneously only theories then only MCQs. I need to mix up. I need to segregate the day in such a way that my attentiveness is maintained, my boredom does not cloud your preparation, right, on that particular day. So 1 hour MCQ, then 3.5 hours I'll revise whatever topic I'm stronger in, right? Then 1 hour of MCQ again. Finally, I have 1 hour for revision. Because what I'm doing here is, you can see, I've studied in the beginning the beginning of the day I'm fresh. I'm studying something which I'm weak in, so I have more attentiveness. I'll be solving the MCQ. So some theory, some MCQ. So there is some change in the menu. Then again comes theory where I'm strong in. So it is my forte. So I'll be more interested in that. Then I'll be solving MCQs for that particular topic. And finally, I have 1 hour of revision. Now, see guys, this 1 hour of revision, it might work as a cushion as well. For example, suppose because of some reason, some relatives came or something happened because of which your 30 minutes is gone. Yeah, so you are now in lurch. What to do? So I'll do what? I'll take out 30 minutes from here to compensate that loss, and now I'll revise only for 30 minutes. Right, so it might work as a compensation, but do not keep it in your back of the mind that I have that 1 hour, so I can do whatever I want, because this revision for 30 minutes or 1 hour of whatever you have studied yesterday is very important, guys. Very important. If you do that, and at the end of the day, when you go for the 21-day revision, it would become much more easier. Otherwise, revising in 21 days is very difficult until unless you have done this 64 days revision properly. This is what I'm gonna do in those 64 days. This is how am I gonna plan my one particular day. And as a fourth question, someone had asked me how to complete particular subject in the allotted time. It's a pertinent question, isn't it? How am I gonna do that? I'll just give an example guess here. Let us see how. See, for example, I have given 3.5 hours in pharma to CVS. So today is my CVS day for pharmacology, and I have 3.5 hours. I need to finish complete CVS in pharma in 3.5 hours. Now I might take these 3.5 hours, and let us assume I have three topics here: the antiarrhythmic drugs, congestive heart failure, and antihypertensive. These are three important topics that would consume most of your time. So let us say these are three topics. If I begin here without keeping these topics in mind, and I would just begin the flow, that I would complete as it happens without any preparation, then you would see that you might not be able to finish in 3.5 hours. You might actually end up consuming 5 hours or 6 hours. Now that is something you cannot do because you don't have time. You have to finish it in 3.5 hours. So what you'll do here is you'll divide this 3.5 hours again into these three topics. So here I will say, let us suppose antiarrhythmics, I'll be giving 1.5 hours, CHF 1 hour, antihypertensive 1 hour. Because even this you have to chalk it out for every day. Now you know that you're looking at the watch that I have 1.5 hours, I have to finish antiarrhythmics anyhow. Now if you achieve these small goals, then at the end of the day you'd be able to achieve this bigger goal, that is finishing the complete CVS in 3.5 hours. Now this is something you have to break down, even these 3.5 hours for those particular day, which I've told you, so that you can achieve your goal easily, right? If you would do this, then you would be able to complete a subject in a particular allotted time. Now, mind that revision is never perfect. You'll never be able to achieve whatever you have thought. It is always near perfect. Whatever you have planned, the more you can reach to your goal, to your target, the better it is. But do not get depressed if you're not able to achieve your goal. If you are nearby, if you have planned, you'll not be able to achieve 100%. If you're nearby, somewhere 90%, 92% of your goal you're achieving, is well and good, right? Another question, guys, someone asked me how to revise the vast topics. How to revise vast topics, guys? I'm not worried here about those 64 days because you would be able to revise those vast topics. The only thing which I'm worried about you is how to revise these vast topics in those 21 days. It's a very too vast topic, you'll not be able to revise. So there's something which has to be done during the time of preparation. If you're still preparing and if you still have some number of days, then now you can do what? You can select those vast topics, and suppose there is a topic in 50 pages. What I'll do something to squeeze it down into 4 pages, the important stuffs. So I'll do here is I'll take 4 to 5 pages, and I will chalk down all the important things in these 4 to 5 pages. Or I'll take a page, I'll draw a diagram of a human being, and somehow in that human being I'll try to arrange the symptoms, the diagnosis or the treatment, everything, right? So do something to squeeze these vast topics into small pages. These small pages at the end of the day will help you in revision, right? So guys, this is how you can deal with the vast topics, and you need to revise them. It's not that you not revise them, but you can condense the content to as much less as possible for frequent revision. Mm. Another question, guys, how to revise pharma? Someone asked me, guys, how to revise pharma. Guys, revision pharmacology is same as that. But if you're too much worried about pharma, if pharma is too much of a trouble for you, then we can do what here? You can make a triplet. So I asked you to combine two subjects, right? Two subjects. If pharma is too weak for you guys, then what? Then combine pharma with two subjects which you are strong at. So do one thing now every day. Every day you will begin with pharma, then other two subjects, right? Other two subjects, suppose this is your surgery and obs gynae, for example. So I'll divide the amount of hours accordingly only for pharma. What happens because of this is, suppose if you are about to revise pharma for combining with any other subject, suppose you are about to revise in 8 days of pharmacology. Now because of combined another subject, this 8 days would become somewhere around 16 days. What it does is, now I'll be revising pharma slowly and steadily. So if I was supposed to revise 3.5 hours per day, that would come down to 2 hours, for example. 2 hours. So the number of hours per day will decrease. So that will give you frequent revision. And if I'm studying the same thing or revising the same thing in 16 days, now that would increase retention for that particular subject. So this is something you can do for pharmacology. If it is too weak and if you're too much bothered about pharmacology, break it down into more number of days, and for that combine some other subjects with it. This is one thing you can do here. Finally, guys, at the end of the day, I'll be looking at some of your doubts that you have asked in Facebook, right? So aspirant NEET PG, please post a routine schedule for revision and how much time for revision, guys, and month of December, what should be done. So I think I've covered all of these, right? Second, Dr. Kaushik Rao Jadhav. Sir, I've started revision, but I still feel that it is too late. Now, your first question, guys, too late. Never. You're not too late. I would say rather you are on time, or even I would say I would take the liberty to say that you're even before time. I know, guys, most of 90% of students, they would not have started revision by now. They would be now hurrying up to finish the course by the August end or September end. Maximum students, they start revision in the beginning of October. So you're pretty much on time. All right, so you have joined Mero, and Mero has high content. There is no doubt about that, which I feel I can't complete. Now, see, guys, in revision, as I said, revision is never perfect. You can always complete. The only thing is you need to strategize. If you look, if you'll stand and look at the subject vaguely, you'll feel that obviously you cannot complete because it seems like an Everest, right? Only you'll have a confidence that you can solve it after you break it down gradually into multiple pieces, bits and pieces, then you can revise them. And though I complete, I feel it could be incomplete. It is not incomplete, guys. Marrow has the most standard content as of now, and if you finish that revision, right, even twice or thrice, then you would be on a better position as compared to other students. Coming to the next doubt, guys, Dr. Saitya Rao, how to revise pharmacology. So, guys, I've told you how to revise pharmacology and last minute revision topics. So, I'll be posting that rather than discussing here. I'll give you a post on the most important topics that you have to revise. And how to revise pharmacology, I told you in the last 5 days, the 3 hours you have to revise. You have to cruise through these notes, right? So there is another PG aspirant NEET completing in the month of September. And can I start revision from 1st of October? 90 days. Exactly. This is what I have told you, guys. This is the ideal thing to do. Right, guys. So Dr. Simran, methods to revise, guys. I've told you 2 subjects a day or 1 subject. I've covered how many MCQ practice we do during revisions. So I've given you, it's not about how many you can do it, it is about how much time you have. You have to make a balance between theory and MCQ. So I've covered that part as well. Topic wise or not, or subject wise, I've already told you guys how to increase speed during revision. Exactly, that part where I covered, if you can see, I told you how to finish a particular topic in a stipulated time, right? So CVS, I told you, you break it down into antiarrhythmic, CHF, and antihypertensive, and you keep on looking at the watch that this is the time I have. So you have to be on your toes. You have to finish it as fast as possible. That is how you can speed up your revision. Right? What if the subjects are stretched during revision due to missing some of the topics while first reading? So yes. Now this happens. This happens, and this is the reason why I've given you 90 days from October to December, right? October to December, your exam would be in Jan, either first week Sunday or second week Sunday. So you'll be having roughly 5 to 10 days in the month of Jan as well. But I'm not calculating that. The reason being, these 5 to 10 days, they do not exist for you. This is for cushioning. So if you miss something, if you miss some days or deadlines, you can borrow. So keep in mind. So suppose the exam date is announced and you have, let us say, 7 days. Then keep this 7 days separate and keep on subtracting. If you're borrowing 1 day from here, then you borrow 1 day from here, right? So this is something you have to do, and this is something that has to work as a cushion, and I am pretty sure all of you will eat away these 7 days, but try to restrict yourself to that. And again, guys, I'm telling you, it's never perfect. You'll not be able to get a perfect revision, 100% perfect revision, no, but trying to make it perfect, the output that you'll get is maximum. Should you try different question platform during revision or stick to one? I would advise stick to one. There is no time jumping here and there, guys. The lesser number of distractions you have, then the better it is. And try to stick to one platform, one node, whoever it is, whatever platform you have joined, stick to that. How much time for first revision, guys? I've covered that, Abhishek. Venkatraman, will it be enough for 60 days for revision, sir? Yes, as I said, 90 days is optimal for revision. That is what you should have. But unfortunately, because you started late or some other reasons, you don't have 90 days. Don't lose heart. 60 days is also fine. So make a plan for 2 revisions or revisions by squeezing those 64 days to lesser, let us say 40 days and 21 days into 15 or 14 days and 5 days. But that 5 days is important. Don't lose that 5 days. That at last, what have I told you, right? So very much you're still in the race even if you have 60 days, but 90 days is better. If you have 60, go with 60 with your whole heart, thinking that I will make it in these 60 days. Be positive. That's important. Important topics to revise, guys. I'll be posting, as I said, soon during revision. Dr. Akhil. 1B Chitkara. Effective revision. Like which subjects first, whether to do individual subjects, question MCQs, or directly go to grand test with revision, and how frequently. Because I told you the way you have to revise. Grand test you have to choose at the end of a week, and in 1 month I would advise to go for at least 2 grand tests, minimum one obviously, but if you can give two it is well and good. If you don't have access to 2 grand tests, one is also fine, and you have to give that 1 day for grand test. So you have that one complete 1 day, give it to the grand test, try to analyze in that day where is it that you went wrong, why you could not solve that MCQ in grand test. So you can take that day as off, that grand test day, and coolly and calmly go through these questions and analyze yourself in that grand test. Ramesh Sivan, 2 videos in Marrow covering anti-drugs of choice and prominent side effects. I'll try, guys. There is a lack of time, and this thing also I'm recording in my own studio. So when it is my own studio, I have the luxury. But I'll see if I can. I will try. November aims, what to study. This list of topic for aims and JIPMA, guys. I always post before the exam. I'll be posting somewhere in September. I post in September. I'll be posting the topics for aims as well as JIPMA. Okay, Dr. Radhe, is it better to give grand tests weekly or go through weaknesses and subjects in that week? Because weekly grand test becomes too much. I think 2 is maximum. Don't go for grand tests more than 2 in a month. So go through 2 grand tests. You can devote that whole day to that grand test with explanations and whatever, right? Now that 1 day, guys, see, go retro. You can go retro on that one particular day, but limit yourself to that 1 day. Do whatever you can on that 1 day, then leave that grand test, right? I guess so. What should we, Dr. Man? What should we read 1 week before exam? Before exam. So, guys, I've already told you how to prepare that 5 days, or you can make it 1 week as well, whatever suits you, right? And strategy for MCQs, anterograde or retrograde. Because MCQs, the first thing you must do is you must go retrograde. First, try to solve an MCQ. Most of the MCQs you would be able to solve it. If you're not able to solve, then go back to the explanation and see why you're not able to solve that. That is the best way to solve an MCQ. Dr. Dharma, sir, how to remember those name of antivirals? And it's difficult to remember. I know you are talking about the DAA, I think. Directly acting antivirals. There is a hell lot of drugs I cannot remember, but if you remember in the lecture, I've told you how to remember the mechanism of action in those antivirals. If someone asks you which of the following is an NS5A inhibitor or protease inhibitor, NS34 inhibitor, RNA polymerase inhibitor, I've told you how to deduce from the name itself that which class of drug it belongs to. If it is AS before VIR, right, like ledipasvir, then it is NS5A inhibitor and so on. Remember that much. That is more than enough. If in pharmacology you're not able to recall some names, it's not a big deal. Happens with most of the students. But you're not going to stop at that point and keep crying over that, right? So move on and try to finish as much as you can. Right, yes, Dr. Neha, I started late in June and my course is going to complete around 15th of September. Is it okay to be this much late? You're not late. I said you can begin your revision in October, November, December. You have 90 days of revision. If you are finishing 15th September is good enough according to me. Right, guys. Dr. Sriram, can you make a video of complete DOC chapter wise, like DOC in ANS, CVS, CNS? Or I guess it's on cards. It's on cards. I'll try to make as soon as possible, and I'll post it as well. Dr. Shivani, so please give timeline for every revision and number of revisions required. Because I've already discussed this, right? How many revisions required, Dr. Rushabh, Malani. I told you guys 3 revisions required. Timeline, Dr. Jaya, timeline and strategies for those who are slow in reading. I mean, those who take a lot of time to complete one reading or complete one revision. Because always, see, if you're slow, that does not mean you can speed up yourself. The only thing you need to do here is you need to look at the time, how much time you have, break down your subjects into topics into subtopics, and give them half an hour, 1 hour, 45 minutes. And you know that now the time is ticking. You have only half an hour for that subtopic. You have to finish it up in that particular hour. So you have to push yourself. The only way to get through is pushing yourself. Nobody is a slow reader or fast reader. It's all here how much you are concentrating at that given moment, right? You're not dreaming around in some other world. So if you know that you have half an hour for that subtopic, you guys will push yourself to finish it in that half an hour. So that is how you have to turn yourself from a slow reader to a fast reader. So can you tell about strategy of revision along with internship schedules? Because internship and revision, it becomes too much of toxic because you have to work and you have to revise. I can understand that. And again, you have to follow the same schedule. You have to anticipate how many days you have off duty or you are on duty and how much time you are getting off duty. So what I would advise you is whenever you are on duty, take this time to do MCQs. So in an internship during guys, you're not engaged all the time, right? You have some breaks, a half an hour, 1 hour in between when you're doing nothing, wandering around. So and nowadays you have the luxury of having apps. So take your app and solve MCQs in those time. And then when your duty is over, this is when go and revise theory, but because that requires more peace of mind. MCQs, wherever you're studying, you can just cruise through those MCQs. That is something you can do. One advice I would have for you. Second is not that people who are in internship, Gurarpan Singh, so Gurarpan, Dr. Gurarpan, if you are an intern and don't lose your heart that you don't have much time for revision. I've seen a lot of interns getting very good ranks, even under 500, under 100. And it's all up to guys how you have studied until your final year. If you had joined some um, courses in the beginning of your second year or third year, foundation course, so they're better to do because they would have studied your notes multiple times by this time. But very much you have the only thing about revision, Dr. Gurarpan, is that you have limited time, and according to that time, you have to adjust your subjects in a similar fashion that I've told you for others. Slow readers, guys, I've already told you what to do for slow readers. Please give topics, read, revise like your last year. So I'll be posting this, guys. As I said, I'll begin this revision things in my Facebook group from the month of September. After you're done through your course by the month of August, I'll begin that. So, guys, these are all your doubts that you had asked, and the only whole purpose of this session with you guys is to make you aware of what are the things that you need to do and how you need to chalk out the strategy for revision. And if you do such a kind of planning, it's only then you can have a perfect or near perfect revision. And guys, remember, many people they fail to get a particular rank of choice, or they even fail to break in into the ranks. The reason is an inadequate, improper, or ill-planned revision. This is something you must chalk out properly before going into revision, before diving into revision. And if you do this, you'll be able to cruise through your revision and undoubtedly you'll get a good rank if you have studied well throughout the year. Because no matter whatever guidebooks you have studied, which platform you've used, which teacher has taught you, that does not matter. How much you're utilizing them, turning those information out in your head on that one particular day of exam, that is what is going to make all the difference in this world. So guys, follow this. If you have any doubts regarding revision, still you can comment on this video. I'll be posting it and I'll answer you then on Facebook as well. So guys, my best wishes to all of you. Believe in yourself, and you have come a long route. It's only a few steps more, and these few steps are called as revision. Follow what I've said, make a plan, strategize, and strike hard on the day of the exam. No one can stop you, right? For there is God, and if you believe in Him, He'll always be with you. Thank you. Bye-bye.